How are you?
Good.
Okay. All right. Hi, my name is Cindy Ann Perez. I am a nursing case manager for Valley Hospice.
And I am Gillian Mercurio, one of the social workers with Valley Hospice. We are here today to answer some hospice questions. So here goes. How do you know when it is the right time to consider hospice care?
So, hospice is introduced when a patient has been diagnosed with something that is non-curative. So, we've tried all the treatments, we've tried all the medications, we've done the surgeries, but the disease progression continues and a patient is deemed to have less than 6 months of life left. And so that's when a hospice referral comes in. What are the signs that a loved one could benefit from hospice now rather than later?
Well, a little bit of what you said previously, when you've tried curative treatment and your loved one is still continuing to decline despite those treatment. You might see your loved one sleeping more often. They may not have a good appetite. Their quality of life is getting to the point where they really are having trouble with their activities of daily living. And you might see some behavioral differences. They may be just some of the signs that it's maybe time to start seriously thinking about hospice.
Yeah, hospice can be very helpful early. Just knowing about it and knowing about the different things that hospice can offer a patient and their families. Yeah. So the earlier you know about it, the more opportunity you have to use some of these things that are available to you as a patient.
Absolutely, and I think that goes into our next question. What are the benefits of starting hospice care earlier rather than waiting until the final days?
Yeah, I think that's really just getting to know your patient and your families, getting to know your team as a team. We work together and there's comfort in that. And I think that it's really important to start earlier.
Absolutely. And pain management is a critical aspect of what we do. And by starting services sooner, it really helps us really implement a holistic approach. We do have a very good supportive team. We have chaplains, we have social workers. And, when we can come in sooner, we can meet with the family and really start the conversation of what's important to them. And that will really help navigate our plan of care, which is really tailored to the individual.
Why do some families wait too long to seek hospice, and how can we change that?
I think one of the components that really plays into why some families hesitate is, I think, fear, some denial. Right. No one wants to face the end-of-life issues. One of the benefits by, starting hospice earlier is you can talk through some of those difficult decisions. You can have more informed decisions. You can, with the support of the team, create a space where you can bring those fears and concerns on the table. And I think that can help take some of the anxiety out of the end-of-life process.
Yeah, I agree. And I think we can change that by just, again, having those conversations even before hospice is a thought. These are conversations that we should really all be having, regardless of our health state, at the moment. It's important to be able to verbalize these things. And I think educating yourself on hospice itself is important. I think that's how we would change that.
Absolutely. How can hospice improve a patient's comfort, dignity, and quality of life when started sooner?
It's really just getting to know the patient and them personally, their wants, their needs, their dislikes. We want to get to know them, and we can provide comfort and support by using those things.
And I think feeling heard, respecting somebody's right to autonomy, having a voice. One question that most of us ask almost on every visit is, what's important to you today? Yes. And that can change. What was important yesterday may not be today, but that is a question that helps someone have a sense of autonomy. We want to respect their beliefs, their wishes. especially, near end of life? Is there certain aspects of their faith that are important? And is there certain practices or ways we do things that can help respect what's important to them? And I think, again, it can help start that conversation with the family too.
What steps should family take to have the hospice conversation with their doctor before it's too late?
I think one thing families can do is set up an appointment, an extended appointment where they don't feel rushed, where they can come to the doctor and really dive deeper into the prognosis and get a better understanding. What's this going to look like? If we go for this treatment, what are the ramifications? How's it going to impact the quality of life? And I think having some time where you can really sit and hear the doctor, not feel rushed, maybe bring someone with you to take notes, to be a second pair of ears. I think that is something that it can be really helpful.
Yes. Hospice is best when it's a family decision, when everyone is educated on what it is and why we're here and how this happened. Families feel like they also have a say in what's happening, and patients most of the time really appreciate that. They appreciate other people sort of agreeing or coming together to make that decision for them. For more information on hospice care, please visit our website.